All right. So what I'm going to do next is I'm going to demonstrate. Okay. What I'm going to do next is I'm going to demonstrate how to perform the exact same procedure, a urinary catheterization, but on a male patient. This is now Mr. Stein. Okay. So it's the same process leading up to this point. I have all my sterile supply ready here. I have my iodine wipe swabs. I have my catheter that's already in the lubricant. That's lubricated 2 to 4 inches. It's just a different process of inserting it rather than into a female patient. Okay, so what I'm going to do is I have my sterile hands. I have my sterile field down here. I'm going to go ahead and take my non-dominant hand and I'm going to grab the shaft of the penis. I'm going to lift it at a 90-degree angle. You never want to force it. You want to be gentle, communicating with your patient when you're doing this. Okay, so how I'm going to clean this is I'm going to take my first iodine swab. I'm going to place it at the tip and do one circle around, toss. Okay, we always go from the center of the meatus around and going a little further down each time, toss, and taking my third one, going at the center of the meatus and going down just a little bit farther, making sure that I've covered enough of the area to prevent a risk for an infection. Okay, I never take my swabs and just go around multiple times. Okay. All right, so I've cleaned. I'm making sure that my non-dominant hand, my left hand is locked. Okay, so I'm going to go ahead, Mr. Stein. I'm going to go ahead and insert this urinary catheter. 1, 2, 3, inserting it at a 90-degree angle. Okay, straight in there. Okay, making sure that it's not getting stuck. Okay, coiling sometimes with male patients, the prostate might be enlarged, and so you have to twist the catheter tubing a little. But it's in there. I've gone about 4 to 5 inches. I'm going to go ahead and lock the tube with my non-dominant hand and hold it in place while I insert the saline into the balloon. Making sure that if your patient starts screaming of pain or complaining of discomfort, immediately after starting inflation of that balloon, you could still be in the urethra, so you need to deflate it and insert it at least a couple, 2 to 3 more inches. Okay, undoing that. And I'm going to gently tug on the catheter tubing, making sure that it's in place. It is locked. Okay, now these are clean hands, and I can proceed just like I did with the female in cleaning up the patient and performing my task to clean up. Okay, so I'm taking the bag out. If I needed to go ahead and collect the urine specimen, it would be the same way I did it with the female patient. Okay. If I had the lure lock or the leg lock system to place this on there and lock that in place, because what we don't want to happen is the catheter tubing to pool. If that pulls, that can actually damage a patient's urethra and cause long-term damage. So you want to make sure that you have something to hold this, whether it's tape or a lock system provided by the hospital. Okay, and then making sure that your bag is hanging not on a rail, on a bar below the bladder. It has to go by gravity to help prevent any chance for infection. Okay, so we will pretend that we had a lock system. I've cleaned up the patient. Okay, all right, Mr. Stein, I'm going to go ahead. I'm going to lower you down. I'm going to get you more comfortable. Is there anything else I can do for you? Okay, all right, so I'm putting up this rail again. So after this, I'm going to doff my gloves. I'm going to perform hand hygiene. I'm going to make sure my patient's at the lowest possible height of his bed and making sure that all his belongings are in reach. His call light is in reach. And making sure that Mr. Stein, if you need anything, if you have any discomfort or pain or anything, please let me know. You have your call light, you have your belongings in reach. And I'm going to go document the insertion of the catheter. Thank you so much. Great job.